Hello everyone, and welcome to your top 5 to stay alive for February 2018. Make sure you stay tuned to the end of this broadcast because I have some special announcements. Now, if you happen to land on the webpage for the top-selling blood pressure meds in the U.S., all made by a Japanese drug maker, you'll see a big photo of a happy man surfing at a beautiful tropical locale splashed across the top. But that could be a rather cruel joke, as anyone who takes these drugs runs the risk of being confined to the bathroom with chronic diarrhea and vomiting, or curled up in the fetal position in bed with horrible abdominal pain. It's one of the best kept secrets in the pharmaland, how hypertension meds that contain the drugs olmesartan, which go under the brand names such as Benicar, Benicar ACT, Azor, and Tribenzor, can cause life-threatening conditions called spruce-like enteropathy, which is remarkably similar to the pain and suffering of celiac disease. The FDA has known about it for years, yet it refuses to ruffle Big Pharma's feathers by doing its job to keep patients safe. Now a consumer group is making a bold move, petitioning the FDA to enact a total ban on olmesartan, saying that it's the only way to prevent avoidable serious harm to patients. And if you're one of them, this is a warning you need to hear about right now before it's too late. I first warned you about the disaster side effects of olmesartan over 3 years ago. I told you how the gut-wrenching symptoms mentioned above, as well as severe weight loss, were remarkably similar to those of celiac disease. And if you didn't realize the potential connection with these drugs, you might just assume you have a painful digestive disorder. But trying to remedy the situation by eliminating gluten or making any other dietary changes won't help at all if what you're really suffering are adverse reactions to these drugs. The FDA has known about these horrific side effects since at least 2012, when a group of researchers from the Mayo Clinic carefully documented what they had discovered about the link. But it took a full year for the FDA to limp into action, requesting a weak warning way down on the drug's lengthy label. And that was it. While there are several hundred well-documented cases of patients who have taken these drugs and then developed this condition, most having suffered severe complications such as malnutrition and damage to their kidneys, if you look at the sheer number of prescriptions given out, it's clear that it could just be a tiny drop in the misery bucket where these meds are concerned. For example, 2 years ago, prescriptions for the top two sellers, Benicar and Benicar ACT, were filled over 7 million times. There were also over 2.5 million new prescriptions given out for those two drugs. It's as if doctors can't write them fast enough. On top of that, last year the FDA okayed the first generic version of olmesartan, so now the sky's the limit in the numbers of patients who may be taking it. That certainly begs the question of how many could be in agony and going to great lengths to eliminate gluten and other foods from their diets for no good reason at all. And don't you think you're in the clear if you've been taking one of these meds for a while either? Even the drug maker admits this life-threatening response can happen months to years after you start taking it. So last month, consumer group Public Citizen finally said enough is enough. It filed an official petition with the FDA requesting the agency put on its big boy pants and axe all the drugs containing olmesartan, the brand names as well as generic versions. Continuing to keep them on the market, the group says, will be risking lives for corporate profits. Of course, you don't have to wait for one more day for the FDA to take action. If you've been prescribed Benicar or anything else that contains olmesartan, you need to make an appointment with your doctor ASAP to change meds, or better yet, find out if you can give all your blood pressure drugs the axe. That's one reason I formulated Cardio for Life. This natural product has no side effects and yet has safely helped thousands of people all over the world who are trying to manage their high blood pressure without taking toxic meds. Let's move on to topic number 2. As we've told you over the years, it looks like Big Pharma and its minions will stop at nothing until every man, woman, and child is popping statin drugs such as Lipitor, Crestor, and Zocor. This, however, could be the cheapest, most low-down trick of all. A group of pharma-connected researchers are trying to tell us that taking a statin can save your life should you be diagnosed with breast cancer. Now, not only that, but healthy women need to start up on a statin ASAP, they say, as those regular users will even have more benefits that should they come down with cancer. But anyone, doctors included, who take those findings at face value need to know this. Numerous previous studies have found the exact opposite effect, especially where seniors are concerned. In fact, the evidence has been piling up that statin drugs are more likely to cause cancer than ever to prevent it. Cataracts, diabetes, Parkinson's disease, devastating muscle pain. How much more bad news do we need to hear about statin drugs before saying enough is enough? Well, how about the big C? It should be no secret to any doctor who has followed statin research that these drugs have long been linked to a variety of cancers. 4 years ago, for example, researchers from the Fred Hutchinson Cancer Research Center in Seattle discovered that women taking statins for a decade or more had 2.5 times higher risk of developing breast cancer. And almost 10 years ago, the physicians from the U.S. and Italy told how data showed that statins actually increase cancer in certain segments of the population, with seniors being particularly at risk. That cancer risk goes all the way back to a statin trial done in the 1990s called CARE, funded by Bristol Myers Squibb, which found an alarming increase in breast cancers, some of which were reoccurrences in women who participated. And you won't believe what happened after that. Did the researchers immediately notify the doctors and patients, or start a new study to closely examine how breast cancer and statins might be connected? None of the above. Instead, from that time on, anyone who had any kind of cancer was automatically ineligible to participate in a statin drug trial. How's that for resolving the problem? But of course, that didn't make the statin cancer link go away. Actually, statins have been found to cause cancer in laboratory animals in doses similar to those people are taking today. So those CARE trial findings shouldn't have been a surprise. Now, however, a group of researchers out of Denmark with connections to drug makers such as Pfizer, Novartis, and AstraZeneca are attempting to make the case that women popping a daily statin drug can up their odds of surviving breast cancer. The group pulled the rabbit out of the hat by using a statistical magic trick called relative risk. Remember that. That works by taking a pool of people and estimating how many of them should get a particular condition. Say, for example, they expect 2 patients to develop a disease, and only 1 does. They'll claim that lowered by 50%. They use the same relative risk to promote "Down with Crestor" you see on TV every day. Lowered it by 30%. Relative risk. It's a smoke and mirrors deception that Big Pharma uses all the time, but it still won't stop doctors from telling patients that breast cancer survival is another statin benefit. That is why it's so important that you know the full story. And statins aren't dangerous just for women. Recently, a cardiologist bravely came forward to tell his peers that the knee-jerk policy in hospitals all across America to prescribe high-dose statin immediately to any patient who has suffered a stroke has no data to back it up. It's all risk with no gain. So if you're currently taking any cholesterol-lowering drugs, you need to sit down with your doctor and discuss quitting them as soon as possible, because the more we find out about statins, the clearer it becomes how horribly dangerous they really are. And remember, arginine-derived nitric oxide, as found in the Cardio for Life, prevents the LDL cholesterol from oxidizing. It's only when then that the cholesterol becomes a problem. Statins only block the liver from producing the cholesterol, which leads to all kinds of problems, since cholesterol is a very important molecule in controlling most of the body functions. Enough. Topic number 3. Dr. Benjamin Rush. You know that name? He was the only doctor to sign the Declaration of Independence, and on the day it was signed, he said this: "If medical freedom is not guaranteed and specified, it will be like that one group of doctors would monopolize healthcare by passing legislation to outlaw their competition, other types of healthcare." Never made it into the Declaration of Independence. But this is exactly what happened. Around 1900, the American Medical Association came into existence and went bankrupt. Then in 1910, the oil and chemical giant Rockefeller Foundation stepped in, bailing out the American Medical Association, giving them millions to prop up medical schools to teach that healthcare is actually disease care controlled by their chemicals, or better known as prescription meds. And today, it's the centuries-old alternative health treatment that Big Pharma would like to become extinct, which is homeopathy. If you've ever used homeopathic remedy, you've taken part in a 200-year-old method of treating conditions and illnesses using the principle that less is more. In fact, homeopathy was used exclusively until the American Medical Association came around in 1900. But for the FDA and all of its friends at Big Pharma, however, the fewer homeopathic remedies they see on the shelf competing against the mainstream drugs, the more they like it. In an ongoing attempt to get this therapy out of our hands, the FDA has now revved up its attack on homeopathy by issuing a draft guidance outlining how it intends to slowly but surely do away with it. Even if homeopathy is something you've never used, it's urgent that you get involved in opposing any such effort, because what's at stake is more than just well-established and effective treatments. It's our freedom to choose what we believe is best for ourselves and our families. And believe me, the FDA's attempted to strike on homeopathy is only the beginning. You know, when Mr. Vaccine himself, Dr. Paul Offit, praises the FDA's actions, it's something that will benefit Big Pharma in a big way. And his comment about the new FDA guidance that was just issued was as snooty as can be. He said that it's about time the snake oil salesmen were held accountable for what they're selling. Held accountable? Maybe it's time for all of Dr. Offit's buddies at Merck and Pfizer and AstraZeneca be held accountable for the deadly drugs they produce. Please, don't get me started on that. But what the FDA is doing now that has Dr. Offit so excited is introducing a new policy that is be calling a risk-based approach to regulating homeopathic treatments. In other words, the FDA is trying to put more regulatory hoops in the way you'll find in a dog and pony show. What irks Big Pharma the most is that these products are allowed right now anyway to say on their labels what they're best used for, such as to treat congestion, a sore throat, or the flu. And while the FDA is still telling reporters that public will still have access to many of them, it's also saying that it's going to address situations where homeopathic treatments are being marketed specifically for diseases and conditions, which is exactly how they're sold. Seriously, why doesn't the FDA come right out and say what it means instead of feeding us confusing bureaucratic lingo meant to disguise its real intent? Remember, this is the same agency that back in 1988 established regulations for homeopathic remedies that didn't require them to go through the same approval process as prescription drugs. The basic principle that by using the smallest amount of an active ingredient, including plants and even insects, diluted hundreds of times, you can achieve the most benefit, has a long-running track record of helping people all over the world. Actually, it's a leading alternative treatment used by European doctors. Health Science Institute panel member Dr. Mark Stengler, a longtime supporter of homeopathy, says you won't find a safer treatment in all medicine, and as these remedies are so highly diluted, he says, there is virtually no chance of side effects when taken at their proper doses. But the very fact that homeopathy really works is what appears to be frightening the FDA officials and their pharma allies the most. As Dr. Stengler says, there are dozens of studies backing the therapy for pain, allergies, mood disorders, and more. And as I said, it's important that you speak up on this issue because, like in an avalanche that starts with just one little snowflake, this could be the beginning of the end for all kinds of alternative treatments that you depended on, like Cardio for Life. Whew, don't get me started. Topic number 4. Each year during the flu season, I discuss, and we got a flu epidemic going around, right, how a virus works in the human body. Understanding how a virus works, what you can do, and what to expect if you become ill with the virus or flu is very important. When this virus or germ enters your body, its first objective is to attack and enter a cell. Once in that cell, it will start replicating like a Xerox machine and continue to do so until the masses of replicated exceed what the cell can hold, and the cell will burst. Now, each replicated germ will then seek out a new cell of its own and do the same thing. If your immune system is at a healthy level, it can kill the germ before it enters the cell and or while it is in the cell, if it detects it. In most cases, it does. Using colloidal silver daily helps support a healthy immune system and possibly avoid these infections from getting started. Now, when your immune system does not detect a viral infection early enough, the virus will spread throughout your body and you can become ill. Your immune system stores 25 million to a billion different T cells, which are members of the white blood cell family. Their job is to kill infected cells. The problem is that each T cell is different and can only kill a specific germ. Your immune system also has helper T cells. Now, the helper T cell's job is to identify the killer T cell needed to kill the infected cells. So one is like a communicator. It'll call it in an airstrike. Once identified, your immune system will produce more of the needed killer T cell to defeat the specific virus. The virus has had a head start and your immune system is playing catch up. This is where the term or phrase, a virus will have to run its course, comes from. Should you go to the doctor if you become ill? Absolutely. You need to identify what is causing the illness. What can you do for it if it's a virus? Give your immune system what it needs to help fight off the virus. The most obvious choice is colloidal silver. Lab tests show that colloidal silver can be helpful against many different strains of bacteria and viruses. Colloidal silver is available in regular and extra strength. Go anywhere online. You should also up your vitamin D3 and vitamin C, which are great nutrients that support the immune system. I also recommend keeping zinc lozenges around, like Airborne or Coldies. I keep them around as soon as I get a scratchy throat or start sneezing, boom, I start chewing on those things and it's gone. Be careful and wise. Do not misuse antibiotics. Antibiotics are not useful against viruses. Misuse and overuse of antibiotics has led to the resistant bacteria strains, according to the Centers for Disease Control. If you give your immune system some extra support on a daily basis, your chances of fending off the infection are greatly increased. And remember, wash your hands frequently, eat nutritious food, drink plenty of water, get some good rest, and take colloidal silver daily during flu season. And according to a bombshell new scientific study published in the Proceedings of the National Academy of Sciences, finds that people who receive flu shots emit 630% more flu virus particles into the air compared to the non-vaccinated individuals. Isn't that interesting? In effect, these findings show evidence that flu vaccines spread the flu, and that so-called herd immunity is a medical hoax because the herd is actually transforming into carriers and spreaders of the influenza. Want to avoid the flu? Avoid people who got the flu shot. And never, ever, ever get one yourself. CDC is claiming that the flu shot this year is only 10% effective, yet people are lining up to dump toxic chemicals like mercury and aluminum into their bloodstream, compromising their immune system, their nervous system, their brain, and all these different organs of their bodies. People, just say no. And finally, topic number 5. Nothing to sneeze about. You know that tickly feeling that starts in your nose and quickly morphs into a loud achoo? To you and me, it's just a sneeze, but to scientists, it's known as airflow dynamics. And when your dynamics start flowing in a public place, like onto your dinner companion's plate or in a movie theater, you will be inclined to try and stifle it. But I got a clue. Don't. If you feel a sneeze coming on and you interfere with it, a new study is telling us that the consequences might just land you in the ER with a serious injury. Here's what you need to know about how a sneeze can become so dangerous. When a 34-year-old man in Lancaster, England, showed up at his local ER in extreme pain, his neck so swollen that he was barely able to swallow or talk, doctors could have been dealing with a medical mystery. But he managed to communicate what had happened. He tried to stop a sneeze by pinching his nose and closing his mouth. That's when he heard a popping sensation in his neck. A subsequent CT scan showed that the explosive force of the sneeze he attempted to suppress had actually ruptured his throat. This sneeze stifling scenario was just documented in the Journal of British Medical Journal case reports, along with the warnings from the doctors about how dangerous that habit can be. And once you realize that sneezes can be measured in miles per hour, with some findings saying air is being projected out of your nose and mouth at speeds of around 150 miles an hour, it makes sense that resisting one can cause so much damage to your body. While the man in England did recover, although he needed spending a week in the hospital where he was given an IV of antibiotics and fed through a tube, his case isn't the worst case that can happen. As doctors who have chronicled the man's case study, trying to stop a sneeze has been known to result in air getting trapped between the lungs and even the rupture of a cerebral aneurysm in the brain. This goes a long way with the previous research that found restraining the impulse to sneeze can result in a sudden elevation in blood pressure and even rupture of blood vessel, so in your eyes, in your brain, or wherever. So please, if you got a sneeze coming on, you feel that tickle, let her rip. All right, got one testimony for you today. I started using Cardio for Life in 2016 after my second heart attack and upon approval of my cardiologist. Then I got away from it. He sent me to another doctor who is a specialist lowering cholesterol and triglycerides. She wanted me on another medication to lower my bad cholesterol, probably a statin, but I didn't fill it. I got back to taking Cardio for Life instead. I went back to her last week for my 3-month checkup, and she could not believe my numbers, and especially after telling her I was not taking her meds. She then asked what in the world I did, and I told her about Cardio for Life. She wants more information. By the way, she wanted my bad to go from 80 to under 70. It went down to 54, and my triglycerides and total cholesterol went down as well, and I'm not having any more chest pains. Well, thank you so much for that, Roger. People, I'm telling you, this is Heart Health Month, February. We can help so many people that have not heard about Cardio for Life. In fact, what we're offering this month is 10% off. You'll be getting an email in your box. I'll give you a little secret. The coupon code, so when you go to checkout, is LOVE. Love your neighbor, people, and give them tell them about Cardio for Life, or maybe buy them some. As far as blood pressure, diabetes, cholesterol, heart disease, stroke, erectile dysfunction, kidney problems, lung problems, respiratory problems, it helps a lot of different things. So everyone across the world needs it. So get going. Second thing, oftentimes I get frustrated because it seems like Cardio for Life is about the heart, and it's about sickness and disease. So if you tell a young person, say a 30, 40-year-old about it, they just poo-poo it and say, hey, I'm fine, I'm going to live forever. And yet you read about people that are 30, 40 years old having a heart attack or stroke and dying. It's possible. So what we decided to do is relabel Cardio for Life. It's still the same product, but we're going to call it Max Fitness. And you could find it on the website, but I just want you to know it's the exact same product, same exact ingredients, but we're going to be out there. We created a new website called trymaxfitness.com, and we're going to be marketing to young people because young people need to get started on this. People often ask me what age children can take it. I mean, it goes by dose. If they're 25 pounds, you give them a quarter scoop. If they're 50 pounds, you give them a half scoop. If they're 100 pounds, you can give them a full scoop after that. If they're 200 pounds, you give them a double scoop. But even children could benefit. It has all your vitamins, all your minerals, all arginine, which converts to nitric oxide, which is healing throughout the body, increasing oxygen. It has electrolytes like potassium and magnesium to help get that normal heart rhythm going all the time. So please, and omega-3, which is an anti-inflammatory. So please, if you see it on the website, you could still order Cardio for Life, but if you have a loved one that's 30, 40 years old, tell them about Max Fitness. Get them started on it right away. And finally, I'm looking for some video emails. We like to read emails, but my marketing people say it's better to have video emails on the website. So what I'm going to do is this. If you send me a video, email, MP4, whatever it is, take your phone, short video, send it to Dr. Harry, DrHarry at Comcast.net, DrHarry at Comcast, COMCAST.net, and I use it on the website. I will give you, I don't know, 2-3 free jars of product. How does that sound? So send me those video testimonies, and I'll take care of you. I promise. You'll get a copy of my book too. All right. Well, that's it for today. Remember, Heart Health Month. This is an important month. Get the information out there about Cardio for Life and Max Fitness, and we'll see you next time. For now, God bless you all. Thanks. This is Dr. Harry saying good night.